we are likely to see fairly rapid increase as well, and that will almost certainly then lead to a further wave of COVID, just as we seem to be on the decline from the previous wave, sadly.
Now, it's called XB.1.5 and it's now causing major concern among the world's health bodies. It's a subvariant of the Omicron strain of COVID, identified so far in more than 25 countries, including the UK, and is the most transmissible yet. That's according to the World Health Organization. Meanwhile, China's seeing a surge of COVID cases, mainly from older variants, with reports of hospitals and crematoriums being overwhelmed. And from today, passengers arriving in England from China will have to provide a negative COVID test before they board a flight, a step the EU is also urging its member states to take. Let's speak to Professor Paul Hunter from the University of East Anglia. He's a microbiologist and the first Professor of Health Protection to be appointed in the UK and a contributor to UK and WHO public health initiatives. Good afternoon, Paul.
Good afternoon.
Should we be concerned about this subvariant of Omicron, XBB.1.5? It's been rather jazzily named.
Yeah, I think the evidence, certainly in the US, is that this thing will outcompete other variants quite quickly. And it early in December, it was about 2% of all infections, and then by Christmas it was 40%, which is a huge increase. And if that mirrors the situation in Europe, we are likely to see fairly rapid increase as well, and that will almost certainly then lead to a further wave of COVID, just as we seem to be on the decline from the previous wave, sadly.
So 40% of COVID cases in the US are this Omicron variant, XBB.1.5. How do we know, kind of seriously, how do we know that we're not already in the grips of another COVID wave here? Are we confident that we are gathering the data as we need to be?
Well, yeah, I mean, the problem over Christmas, New Year break always is that infectious disease surveillance systems struggle to give you a really good up-to-date indication of what's happening. Hopefully, we'll be getting some data out this afternoon from the Department of Health and Social Care. But I think at the moment, looking at the Zoe app data, which has continued to publish its estimates, that does suggest that infections from COVID are still falling, although clearly with this new variant, how long that decline will continue is open to doubt.
Do we need to be concerned about the new variant? It is much more transmissible than older variants, and that's why it's excelled at such a pace.
Indeed.
Is there any evidence about it causing more severe disease, or perhaps being able to evade vaccination?
Well, I think it's transmissible because it is able to evade immunity, whether that immunity comes from vaccination or infection, or more likely in the UK, both hybrid immunity, which is people who've been vaccinated and had an infection. But the indications at the moment from the US is that it's not causing any more severe disease than previous variants, although clearly if numbers rise very high, then it will still drive up hospitalization rates and sadly also death rates. But one of the good things about immunity to COVID is it does seem to be, even though you lose immunity to infection over relatively few months, immunity to more severe disease that's more likely to put you into hospital, does tend to be transferred between variants. So I think the signs are at the moment that yes, it's going to cause a substantial wave of infections, but that those, if you're infected, you're not likely to get more sick than you were with previous waves.
Would you recommend the wearing of masks now?
I think generally I would follow the UK advice in that if you're unwell, to wear a mask. I would also add that if you are particularly vulnerable, if you're and you're in public, particularly if you've not had COVID recently, then I would continue to wear a mask. But for more general, otherwise healthy people, particularly if they've been vaccinated and have already had COVID, I think the value of masks is now not as great as it was even a year or so ago.
Interesting. Well, thank you so much for speaking to us. Paul Hunter, Professor of Health Protection at the University of East Anglia. Thanks for joining us on Times Radio.